Hello, good evening, everyone. Welcome to day 3 of Faculty Development Program on Science of Rehabilitation, organized by Department of Physical Education, Auro University, and Spinex Global. Today we have with us Dr. Jatin Maheshwari, Director of Crossbridge Institute of Health and Sciences, Co-op Officer and Assistant Lecturer at St. John Ambulance Brigade and Indian Red Cross Society, Delhi. He has also served as a head physiotherapist at Born to Play, India. He has trained more than 2,500 students in various courses like CPR, BLS, First Aid, On-Field Injury Management, Kinesiology, Tapping, etc. He is the author of 2 books named A Guide to Body Weight Exercise in 2018 and Save a Life in 2019. He worked with Indian shooting team athletes. He also served as a physiotherapist with England Country Cricket Club, Delhi Soccer Association, National School Games 2017, 18 and 2019, Indoor Sports Fairs Delhi 2019 and 20, the Amateur Football League Delhi, Kickboxing Federation Championship 2017 Delhi. He has done Diploma in Sports Nutrition from USA and various certificate courses like Kinesiology Tapping, Strength and Conditioning, Manipulation Therapy, and Dry Needling, etc. He has invited as a resource person in many colleges and universities like Banarasi Das Chandilwal Institute of Physiotherapy, GGSIP University, Delhi, Ahmedabad Institute of Medical Science, Ahmedabad, GD Goenka University, Gurgaon, Jaipur National University, Jaipur, Manav Rachna International University, Faridabad, Mewar University, Mahatma Gandhi Physiotherapy College, Rajasthan. It is my privilege to introduce our guest speaker, Dr. Jatin Maheshwari. Now, not taking much time, now I would like to request Dr. Dr. Jatin Maheshwari to start his presentation. Dr. Jatin Maheshwari, welcome, sir.
Thank you so much, ma'am. Hello to all the viewers. It's been my pleasure to be here in this platform. I would like to extend my thank to Dr. Neeraj Bhanshali, sir, and Dr. Janvi, ma'am, Spinex Global, for providing me such a nice platform to share my knowledge to the students so that they can get even more better in the topic that is the exercise physiology. That is the topic which is much needed in the clinical aspect also. And I would just think that people will gain more knowledge from this webinar.
Yeah, thank you so much, Janvi and Dr. Jatin. Thank you for accepting our invitation, and I wish that your knowledge sharing will be a great help to all of our viewers, and that will definitely uplift our professional values as well. I wish all the best to all the viewers, and wish you all the best, Jatin. Also, thank you so much.
Thank you. Thank you so much, sir. Thank you. Okay. So, as the ma'am has introduced me, so I'll be taking the topic applied exercise physiology, the exercise during heat and cold environment. Okay. So, first of all, I want to brief you guys about what is exercise physiology, how do we use it in our clinical practice, how do we use it in the sports field. Okay, there are many things that many people think that exercise physiology is related only to the sports physiotherapy. It's not like that. It's also work in the clinical practice that the few physiotherapists of us uses it, and few doesn't know how can we use this in our clinical practice also. Okay, so I'll be taking a brief overview because in this concise time I can only take the brief of about the exercise physiology because it's a vast field that you need a more and more time to go through with all the things inside this. Okay, so let's get started. So in this throughout this webinar, you will be able to question a brainstorming questions like how a body regulate or respond for the whole hot and cold temperature, just to avoid the complications in our body like heat stroke, heat syncope, or the frostbite, etc. Okay, how the environment is going to regulate the hot and cold temperature to our body. Okay, and how the humidity is a major cause of dehydration when you are going to exercise in the hot and humid temperature. Okay, and what type of clothing and the like you can see the fabric of cloth, the color of cloth should we wear during exercising in hot and cold temperature. Okay, and why we should not, like many people tends to wipe the sweat quickly, like the person is doing exercise, the sweat comes and he suddenly just wipe the sweat off. Okay, and why we should not do this, the wiping of the sweating quickly when it comes. Okay, and how the elite long distance marathon runners can tolerate heat more than like 4 times in comparison to the normal individual. Okay, so these are the things you'll be knowing in this short webinar of this topic. Okay, so, and if I talk about the content, the what the things you'll be learning in this, like what is the exercise physiology, introduction, what is thermoregulation, the physiology behind the thermoregulation, what are the heat dissipating mechanism. Okay, the clothing in hot and cold environment, what is heat acclimatization, the word acclimatization, what does it mean. Okay, and dehydration and hydration during the exercise, either in the hot or the cold weather. Okay, and the cold acclimatization, like what are the adaptation of the body in the cold environment, what is the water intake guidelines, clothing guidelines. Okay, so let's get started. So what is exercise physiology? Like it can be simply what the terms tell, exercise and physiology. Exercise is mainly the activity and the changes in the body that is taking place. As per the definition, like it is the body's response to the physical activity, okay, that can make the changes in metabolism and the different areas or different systems of our body, like the cardiovascular system, the pulmonary system, the musculoskeletal system, and the cellular changes that can be happen while doing exercise. Okay, like, so I want to tell you this exercise physiology is of two component, it's having the two field, that is the clinical and the sports. Okay, most of the people knows about that exercise physiology is related to the sports only, but it is also related to the clinicals. Okay, so if I talk about the sport exercise physiology, it is related to the sports people, athletes. Okay, they uses the body's response to the exercises. Okay, like how the body is going to respond, on which system. Like if the person is related to the endurance sports, so we'll be applying the exercise physiology in that way, so that the person is going to train in a endurance way. Okay, if the person is doing a weightlifting, so that to be trained in the power mode. So how the physiology of our body makes the system capable of that particular sport, so that is the exercise physiology. All the regimes of training uh, of the sports exercise physiology is going to apply it on the athlete throughout his, you can say, a competitive phase or off season phase. Okay, so exercise physiology can be applied throughout the we can say the periodization phase of an athlete, whereas many people don't know about the clinical exercise physiology. Like it basically applies as a treatment, as a therapy, as a prevention measures. Okay, like say for example diabetes, how you are going to train a diabetic person, and you would be like by only the exercise, a good exercise protocol, the diabetes can be calms down or even get corrected. Okay, like osteoporosis, what kind of measure, what kind of regimes you're gonna follow, so that it can act mainly on our endocrine system, on the musculoskeletal system, so that it can be cured. Okay, so this way of applying the exercise physiology is the clinical way. Like it had said that the affected individual to show how to exercise in a safe way that can minimize the pain, minimize the complications like the fracture in the osteoporosis. Okay, how can we boost the hormonal changes in our body, like say for example in diabetic and osteoporosis, to neutralize or to maintain the homeostasis of the hormones in the conditions like diabetes and osteoporosis. Okay, now what is that's what we are here we will do. We are starting with the exercise in heat. Like, what is thermoregulation? Before going for the process of like effect of exercise in heat and cold, we should be knowing what is thermoregulation. Okay, it is the mechanism of regulating the body temperature. It can be in the heat or cold to maintain the normal physiological function of our body. Okay, it is known as thermoregulation. Say for example, I am exercising in hot environment. So how my body is responding so that it will maintain the temperature of my body. If the temperature is hot, so my body is supposed to bring the system slightly in a heat dissipating manner. Suppose I'm standing in a hot environment, so how my body will react to make the body slightly cooler so that the physiological function of my viscera will work normally. Okay, and I just want to share some facts like during sleep. Like if you are sleeping, your body is on the lowest level of temperature. Okay, and when you wake, it is a slightly higher. Okay, so in both the phases of sleep and morning weakness should follow the precautious exercise. Okay, the precaution should be taken in these phases of weakness and the sleep. Okay, then second fact is the person can tolerate a drop in the temperature up to 10 degrees Celsius. The what is core temperature, I'll mention it in the next. But when a normal individual is there, he can tolerate a drop of 10 degrees Celsius in the temperature, but he cannot tolerate a 5-degree increase in the temperature. Okay, this is the big difference of the temperature in comparison to the hot and the cold. Okay, and why so? Like, this is the answer. As you can see, the body temperature consists of two components. Okay, that is core temperature and that is peripheral temperature. We call it as shell temperature. Okay, now what is core temperature? Core temperature is related to our viscera. Okay, the internal, the core. Okay, internal temperature, the visceral temperature is known as core temperature. Okay, whereas the periphery temperature is our skin, the peripheries, and this is called as a shell. Okay, if I talk about the total mean temperature, like two components are there, then core temperature, as you can see, contributes a 60%, consists of 60% body temperature, whereas shell consists of 40%. Okay, and if we want to measure these both component temperature of our body, then we have to measure it from the various sites. Like if you want to measure core temperature, you can measure from the sites like rectum, eardrum, esophagus. Okay, and if we want to measure the shell temperature, the periphery temperature, the skin temperature, that the sites are the arm, trunk, leg, head. Okay, so by measuring these two components simultaneously, you will get the mean temperature of your body. How? Like, this is the formula we use to measure the mean temperature of our body. Like 0 0.6 into mean core temperature, which means you will take measurement of rectum, eardrum, and esophagus temperature, take a mean, and multiply it with 0 0.6. In the same way, we'll take the mean of peripheral or skin temperature or shell temperature. Okay, multiply it with 0 0.4, and we'll just add these both mean core and mean skill temperature, and we get the mean body temperature. Okay, now why it is important, you will get to know in the upcoming slides. Now you have go through with the thermal regulation. Now what how the body is going to balance, okay, the temperature, either cold or hot. Like, suppose, first of all, I want to tell you the main priority to balance the temperature is the of core temperature. Body always prioritize the core should be in a neutral or maintained temperature. If there is too much of hotness, the body react in a way to maintain the core temperature, and in the same way for the cold also. Like if there is too much of hot, okay, how the body is going to respond? The body is going to shift the core heat to the peripheries. Okay, say for example, there is 5-degree increased temperature of core. Okay, and so what the body will do? Body will divert the temperature to the skin, to the peripheries, to normalize the temperature. How it is doing? I will let you know. This is the shifting of heat to shell, and if there is too much of cooling, so body will suck all the temperature towards the core from the periphery. So this is the first one, the shifting of the heat to the shell and the vice versa. Okay. The second one is the regulating evaporative cooling. You must have seen, or you must have experienced, when you're doing exercise, the sweating starts. Why the sweating is there? Okay, sweating is there to normalize the skin temperature. Like too much of cooling is there. Core is saying to the warm blood that please do not stay here. Go to the skin. The blood comes towards the periphery, towards the skin. Now the heat is getting the temperature, getting the heat. So what happened? The body activates the sweat gland. The sweat gland will come, the sweat come on the skin, the evaporation happens, and the skin gets cooler. If you have experienced that after doing exercise, if you sit on a place, after some time your body feel cool. That is due to the evaporation of sweat. Okay. Then the varying the rate of heat production. Varying the heat rate of heat production is due to few hormonal changes. Okay. Now, what is the physiology behind the thermal balance? This is a very important things that I want to mention. Like for the thermal regulation, hypothalamus is the central coordinating part. Okay, in the center, the hypothalamus maintaining the temperature of our body. Now, how is going to getting the response that now the body is getting warmer? Two things are there. If the body is warmer, there are thermal receptors in the skin. Okay, they sense the heat and send the signal to the hypothalamus that your body is getting warmer, that your body is getting cooler. Both the signs, the cutaneous thermal receptors will send to the hypothalamus. Second thing, when the body gets warm or cool, it also cools and warms the blood also. So when the blood perfuses towards the hypothalamus, when the blood circulates to the hypothalamus, it sense the temperature of the blood. Okay, when it sense, oh, the blood is warm, I need to cool, I need to maintain the temperature. Or, oh, the blood is cool, I need to maintain the temperature. In two ways, the hypothalamus getting this the signals that now you have to mention the temperature of the body, either hot or cold. Okay. Now the signal have come to the hypothalamus. In which part? In the anterior hypothalamus. Okay, this is hypothalamus. The cutaneous thermal receptors and perfusion of the blood bring signal to the anterior hypothalamus. Now hypothalamus has two parts, anterior and posterior. Okay, when when there is a warm blood and the body needs to lower down the temperature, okay, then the anterior hypothalamus orders the body system to lose the heat so that body can maintain a neutral temperature. Okay, in the same way, if the blood is cool, then the hypothalamus says conserve the heat. Okay, this is the whole phenomenon. Hypothalamus, cutaneous receptors, blood perfusion comes to anterior hypothalamus. Okay, if the blood is warm or more, there will be heat loss by anterior hypothalamus. If the blood is cool, then the posterior hypothalamus will do the heat conservation. Okay, now how the heat loss and heat conservation is going? Okay, here is the answer. If I talk about if I talk about there is cool or cold blood flow is there, what action will be taken? Two action will be there. Decreases the heat loss. Okay, the body will decrease the heat loss. How? Vasoconstriction of the skin vessels. Okay, now just see if the temperature has increased of the core. Okay, sorry, the temperature has gone down. Okay, the coldness is there, so the viscera to be put it in a warmer temperature. Now what the body will do, body will do the vasoconstriction in the periphery so that warm blood does not go to the skin. Okay, he stop or minimize the warm blood pooling towards the periphery so that heat can be conserved for the viscera, and this occurs by the vasoconstriction. Okay, then there is should be increase in the heat production. Heat loss has been controlled by restricting the blood supply toward the periphery. Now how the heat production is increasing? By shivering. You must have experience when you feel too much of cold, you do shivering like kapahat. Okay, you do shivering like this in the winter. This is the voluntary involuntary response of the muscles that core have been sucked all the blood from us. Now how we are going to survive? Then brain, the body is very smart. The body will start the involuntary contraction of the peripheral muscles, that is called shivering. Okay, and that will produce the heat. Okay, and the second one, the body will start secreting two hormones, that is thyroxine and epinephrine, to increase the resting metabolism or metabolic heat. Okay, that's how the heat is going to produce. Now that was all in response to the cold. Okay, now what is the response of the body will come when there is heat, when there is warmer blood perfusing to the hypothalamus, and hypothalamus says, "Okay, now I'm going to decrease the temperature." How? Like first is two mechanism also in this, as you can see. Increase heat loss. The body will say, "Ki there is too much of temperature in the core is coming, and we need to dissipate the heat, we need to divert the heat from there." So again, what body is doing, body shift the warmth blood towards the periphery, and this time it is producing vasodilation in the periphery. Okay, the vasodilation comes, the more blood, warm blood pooling comes into the periphery, leads to the decrease in the core temperature. Okay, second is sweating. As I have already mentioned, if there is increase in the temperature, body wants to vomit, sweat glands activated, the evaporation happens, and the skin gets cooler. Okay, then second is decrease the heat production. If the heat is more, you have to decrease the heat production. How? Body decreases the muscle tones. Okay, relaxes the muscle so that the active contraction of the body does not produce any heat. Okay, second one, a decrease in the hormonal activity of thyroxine and epinephrine. Automatically the production of the heat goes down. Okay, hope I'm clear. This is the mechanism in response to the cooler and the warmer, or the heat or the cold response of the body. Physiological response, I would say. Okay, now we have learned about the physiology behind that. Now there are few things how the environment is working, if we are getting heat or if we are getting cold. Okay, so there are few heat dissipating mechanism of our body. Okay, the first one is a radiation. Okay, look, radiations are, we can say, electromagnetic waves. Okay, when our body gets warmer, okay, it emits a minimal frequency of electromagnetic waves. Okay, so as you can see, like if you having a warmer body, Okay, and if you stand in front of a bigger ice cube, no contact is there, but eventually your body will get cooler. Okay, this is the transfer of temperature or transfer of heat without any contact. This is called a radiation mechanism. Okay, now say for the example of the environment, if you want to take like the sun is too much hotter, there is no contact is there, but the radiations are coming. This is the way same our body dissipate the heat. If you are warmer and you are stand in front of a cooler object, the heat will transfer automatically. Okay, the second one is conduction. Conduction is the transfer of the heat from one molecule of an object to the another molecule of another object. Like if you have done a lot of exercise, your body is warmer, and like you have lying down on a cooler object. After 1 or 2 minutes, your body's the part that is in contact with the cooler object gets cool, and that cooler object gets slightly warmer. And this is the conduction. Okay, in that way the heat dissipates. Okay, third one is convection, the transfer of the heat through air. Okay, it should be propelling air or the still air. Say for example, you come you reach your home in a summer, and you just sit in front of the fan, cooler, or air conditioner. The air, after some time your body gets cooler. Okay, this is the heat transfer through air, convection. Fourth one is evaporation. I've already mentioned, like you got the sweat, your skin is getting hotter, the mind responds, it activates the sweat gland, sweat comes on the screen. Okay, after that the skin evaporates, and that evaporation will cause the cooling of the skin. Okay, now just try to understand one thing. The core temperature is getting hotter, the blood of the core temperature which is circulating is getting hotter, so mind will divert the blood supply to the periphery. Now the peripheral temperature is increasing. Now what? The sweat is coming. When the sweat will come, the evaporation occurs. When evaporation occurs, a cooling is occurring. So the blood supply which is coming in the periphery is getting cooler. When due to evaporation our skin is getting cooler, the blood which is coming in circulation is also getting cooler. Okay, now fifth one is hormonal adjustments. Okay, if you can see in hormonal adjustment, when there is too much of heat, it obvious that the fluid loss is going to happen. Okay, in that fluid loss, the water, or you can say the fluid, is getting loose, and also the electrolyte is also getting loose. Okay, both fluid and electrolyte is getting loose. So what is the body response? If I talk about the fluid loss, the pituitary gland activates the vasopressin or antidiuretic hormone, so that water conservation start by the kidney. Okay, the kidney start conserving the water. It makes the concentrated urine. Okay, it prevent the water loss in the urine, so it is making concentrated urine. If I talk about the how to decrease the electrolyte loss, the renal cortex comes into play. It releases aldosterone hormone, which do the sodium reabsorption. Okay, so kidney is again conserving the sodium, and aldosterone also restricting the loss of the electrolytes in the sweat. Okay, so two works they are doing on the kidney level, on the skin level by the aldosterone, on the kidney level uh, on the by the antidiuretic. Okay, then humidity. The heat dissipating mechanism is humidity. I'll explain it later. I just want to uh, like look at this. This is the points of heat dissipating mechanism in a single image. If you can see, the solar radiation is coming. Okay, towards the body. The reflected radiation from the ground then again coming to the body. The thermal radiation is also coming to the body. And how the heat is dissipating from the body, like evaporation by respiratory. It is a cool. I'm going to mention it in the exercise in cool, but I will mention here like in the winters, if you will blow, the fog comes out. That is the small water droplets. And if you are exercising in the winter, the large amount of the vapors comes out from the mouth. You can see the fog. If you're gonna blow it on a mirror, okay, or a glass, it will make a fizziness, dizziness, fizziness on the glass. So that is the evaporation by respiratory tract. Another evaporation by sweating. Okay. Now you can see the convection is coming through the air. The radiation is coming from the electromagnetic radiation form. Okay. The evaporation that I have mentioned is sweat, the skin and blood convection, which means if the blood is warmer, skin is getting warmer. If the skin is cooler, the blood will get cooler. Okay. Then muscle flow convection, which means the muscle, when you're doing exercise, the blood flow also increases to the muscle. When the muscle gets warmer, same, the skin will get warm, or the visceral structure or the core temperature will also going to increase. Okay. Now I would say about this thing. This is the thing which produces, I would say, a main cause of dehydration during exercise. Okay. Look, when in a normal, when the humidity is normal, like about 40 to 50% humidity is tolerable, normal, or you can also 30 to 40 range you can take, like the sweating is occurring. Okay. The evaporation is occurring, the skin is getting cooler. This is the normal mechanism. But when the humidity is there, humidity is what? The air consists of moisture. Okay. When that moisture settle down on the sweat, it won't let the sweat evaporate. Okay. Sweat is there, the moist air that is in the humidity settle down on the skin, and it decreases or halts the evaporation, resulting zero evaporation, resulting no thermal regulation. The temperature is not going to down. Okay. That is the then what will happen? The sweating will occur again and again and again without any evaporation, resulting in more fluid loss, resulting in dehydration. Okay. Then one thing I want to mention, sweat doesn't evaporate and get wasted, resulting fluid loss leads to dehydration and overeating that I have just mentioned. Okay. And sweat does not hold the skin, evaporation does. That is why I'm saying evaporation, humidity is not letting the evaporation up, resulting in overheating or dehydration. Okay. Now the thing is ki what should we wear while exercising in hot environment? What should we wear, or what color of the clothes should we wear in hot environment? So I would say, I'll say like, please do not wear cotton and linen. Okay. Prefer polyester clothing during exercise in hot. Okay. Why? The question is why we should avoid the cotton, linen and prefer the polyester. I want to say it is related to the sweating. Okay. Like if you will wear a cotton cloth during exercise, the sweating occur, and the time when the sweating will occur while exercising, the cotton cloth will absorb that, resulting zero evaporation, zero cooling, will leads to again increase in the heat, again increase in the sweat, again leads to dehydration. Okay. And also leads to the premature fatigue. Got it? Now, what polyester does is polyester does not soak the sweat. It let the sweat come. So that the sweat will come, evaporation occur, the skin gets cooler, blood gets cooler, core temperature will get cooler. Okay. Then Avoid dark color clothing. Please wear light color clothing. Why? Because black color absorbs the heat. Okay, black color absorbs the heat and increase the temperature of the body. Dark color. The light color will reflect the heat. Okay, and it will help in maintain the temperature of the body. Okay, then what is the acclimatization of the body? What is acclimatization? Acclimatization is the adaptation of the body response towards any heat temperature or cold temperature. That is acclimatization. Acclimatization, the adaptation of the body in response to the high altitude also. Okay, so mainly what is the physiological adaptation of the body is acclimatization. Okay, now what are the adaptation body does in heat? Exercise in heat. So it improves cutaneous blood flow, which means cutaneous blood flow means it improves the peripheral blood flow, which means whenever you're exercising, the better diversion of the warmer blood to the peripheries will occur. Okay, effectiveness of distribution of cardiac output. The cardiac output has to be distributed towards the periphery, because if it will not distribute to the periphery, it will act or increase the temperature of the core, resulting in the complications like heat syncope, heat stroke. Okay, so the circulation of the skin and muscle gets appropriate, which means the core temperature is diverting the warm blood supply to the heat, to the skin and the muscle. Okay, then what is the lowered threshold for start sweating? Okay, which means evaporating cooling begins early in the exercise. That is the acclimatization main response. Okay, which means when you start exercising, the sweating starts in few minutes, so that the core temperature won't increase in earlier time. It already prepares the body. Normally what happens without acclimatized body, the core temperature increased, then sweating occurs. But in this case, a minimal lower threshold of sweating already starts, so that the core temperature won't increase that much. Okay, and the more effective distribution of sweat over the skin, which the term says that effective sweating is gonna occur in all over the skin of the body. Chani, charge, charge. Okay, so the increase in the sweat output, more the sweating is there, more the evaporation is there, and more the cooling is there. Okay, and more the performance of the person is there. Okay, then it lowers the electrolyte concentration wastage, which means less the electrolyte loss is there, more the performance is there, more the ill effects there. Okay, now hope these things are clear. Now circulatory adjustment we have already done, like increase in the oxygen or blood delivery to the active muscles, which is the diversion of the core heat towards the periphery. Okay, one thing I want to, the important thing I want to mention here, many people ask that question, like if it is that much difficult to exercise in heat, how we are going to train the person? If the person is going in the hot countries to perform, if you talk about the sports person, how we are going to train them? So this is an article which suggested that if the person is having better VO2 max, okay, better VO2 max, the person have the capacity for better heat tolerance. Okay, just for an example, the champion ultra marathon runners can increase their core temperature by 4 degree. Like if we can increase our core temperature by only 37 degree Celsius, the champion uh, ultra marathon runners can increase the temperature by 41 degrees Celsius because they are having a good VO2 max. Okay, and why it is occurring? The question is why the better VO2 max leads to the good tolerance of heat, because a good VO2 max leads to a better acclimatization of the body. Okay, when an champion ultra marathon runner will do his activity, sports activity, early minimal sweating will start. That is a good sign. Better distribution of the blood supply to the active muscles so that the heat will not interact with the core that much. Okay, and one more thing, that is hydration. If you maintain the hydration, you are not getting the premature fatigue. Okay, you will not get the problems like heat stroke, heat syncope. Okay, and one more thing I want to mention here, like this I have mentioned for the sports physiotherapy aspect, but if I talk about the clinical exercise physiology, what mistake we do is, either in the winter or the summers, if the person is coming to us, we are following the same protocol of exercise. Okay, we are following the same protocol of exercise, whether the summer is there, whether the winter is there. Okay, so we have to be improvise the exercises. Okay, like if we are doing the exercises in hot, we should keep the warm up minimal. On in throughout the exercise in hot, we should maintain the temperature of the room. We should keep the hydration status tracking of the person. Okay, and if we are doing the exercise in cold, we should increase the warm up time. Okay, and and also we have to keep the hydration status of the person in the cool environment also. Why? I'll tell you. First of all, just this is the you'll get an idea key how much of fluid loss is occurring during the exercise in different temperature. Okay, if you can see, these are the status of at rest. This is the minimal exercise and this is the moderate exercise. We can go through with the liters. We can go with these on unit values. Okay, so these are the temperature, air temperature. Like this is the 26.7 Celsius degree temperature. So at rest, the fluid loss can be 0.47 liter, or we can say, sorry. Okay, and on minimal, this is about 250 ml, and for this about 350 or 400 ml we can say. So this is the fluid loss, and if you'll see, as the temperature is increasing, as the activity is increasing, the fluid loss is also increasing. So we have to keep the track of dehydration and administer the fluid, okay, to avoid the heat complications, to avoid the complications in cool environment also. Okay, now if you can say what amount of fluid loss is occurring and how it is impacting the physiological system or the thermoregulation of our body. Okay, like for a person that is acclimatized, that has already adapted the exercise in heat strategy, they can even get the sweat loss of 3 liter per hour during their intense exercise. Okay, and if I talk about uh, intense sweating is occurring, it may fatigue the sweat glands also, because sweat gland also gets fatigued. Okay, now if you are exercising for prolonged duration, if you are exercising for in intense heat, it will produce more sweating, it will produce more fatigue to the muscle, it will get fatigue to the sweat glands and resulting in impair thermoregulation, resulting in increase in the heat of the body. Okay, and hamper the physiology of the whole body, and you may get the person may get the heat stroke, heat syncope. Okay, and why the premature fatigue is occurring? Because there is a decrease in the sweat rate then, because sweat glands get fatigue. So they are not going to produce the sweat in the same rate they were producing previously. Okay, and they may decrease the peripheral blood flow, because whenever the blood volume comes down of the body, the BP shoots. Okay, the blood supply goes down because the vasoconstriction takes place in the blood vessels. Okay, the heart rate will increase, resulting the increase in the core temperature. So once the constriction is occurring, blood flow is going down, the core temperature will not be able to dissipate the blood supply to the peripheries. Okay, then there is a one thing I want to mention. If there is fluid loss of 1% of body mass of the person, it may increase the rectal temperature. Whereas if you are hydrated, the fluid loss of 1% of the body does not increase the rectal or core temperature, which means hydration is very, very important. Either you are doing exercise in hot or cold environment. Okay. Then these are the few problems that the person face if the heat, if the core temperature increases. The four things are there: heat cramps, heat syncope, heat exhaustion, okay, heat stroke. Okay, so what are the causes of these four things? These are the four things that you have already, I mean, gone through. Like, so I will give a brief overview of this. Like, if you got what is the heat cramps? Like the cramps, like the person will get during the, like if you have seen the people in the later end stages of their matches get the cramps due to decrease the electrolyte thing, that due to the increase in the heat of the body. Okay, it can be intense and prolonged, like tightening of the muscle, involuntary spasm of the muscle. Okay, that can mostly happen due to the decreased electrolytes. Okay, how can you prevent? Rehydrate the person, do the stretching exercises, and I would say take the electrolyte drains. Okay, another one is heat syncope. Okay, causes is like if the peripheral vasodilation or cooling of the venous blood, hypotension, hypohydration. Again, the thing is coming hydration. There is less fluid, we can say the less fluid or water remain in the body, like if the person done a prolonged time of exercise, like the person can feel a slightly headache. Okay, syncope. Okay, and the temperature, the body can get warmer even. Okay, increase in the rectal temperature or esophageal or eardrum temperature more, which can indicate that core temperature is increasing high. What you can do, like acclimatization process, do not do the exercise in high temperature for more duration for high intensity exercises. Okay, you have to do it in a serial. Okay, this temperature is, I mean, today temperature is this, so do not do more than this exercise. I think I don't have enough time to explain that ACSM guidelines, but American College of Sports Medicine have given the guidelines. Like if the temperature is this, you can do the match for this duration also. If the humidity is this much, you can perform this duration of all game. So proper guidelines are there. Ki this temperature, this amount of work. This humidity, this amount of work. Okay. Then heat exhaustion, the if the negative water balance is there, okay, the flushed skin, sweating will go down, syncope is there. So again, proper acclimatization, hydration can be done, or if needed, the regular medical care can be provided. Then result the last one, the final one is the heat stroke. Okay, the failure of the body, it can damage the brain also. Okay, and I would say it is a medical emergency, need to shift the person to the regular medical care. Okay, then we have gone through with the dehydration, how the loss is occurring, how the loss dehydration, I mean the loss of the fluid is hampering the body's physiological function. Now what are the question is if, how we can got to know what amount of water we should intake. Okay, so one This is the table. If you are not going to memorize this table, I would tell you one thing. If the person is doing workout, exercise, or playing any game, if the session has ended within 1 or 1.5 hour, okay, just measure before starting any workout or routine, just measure your body weight, and after completing the workout or you're completing your game, take your body weight. The difference in between your body weight is the requirement of fluid that you have to take. Okay, and in between your workout, if you have urinate, then also measure the amount of urine that you have passed. So the amount of urine that have passed, add that amount of fluid loss into your intake of water. So that, like, say for example, the person did the exercise. Before exercise it was 58, after exercise it's 57, I would say. And he also went for the urination, about 200 ml. Okay, so the difference of the body weight is 1 kg. So 1 liter plus 200 ml loss in the urine. So total 1200 ml of water or fluid intake he have to take after his workout. Okay, this is the normal and easiest guideline, I would say. Okay, and as per the guidelines, do not take the plain water. Always include 0.5 to 0.8% of electrolyte in that fluid or water intake, so that it can recomplete the electrolytes in your body that have wasted during the workout. Okay, now as per this chart, if the air temp the what is the water or fluid requirement, okay, that is have the component like temperature and humidity. Okay, like this is the temperature in Fahrenheit and this is the humidity. And this is indoor if you are doing exercise in indoors, and if you are doing exercise in outdoors. Okay, at rest you have to take, and these are the values in liter per hour. So at rest at this temperature and humidity, inside means you are not under the sun. At rest you have to take 0.2 liter, or you can say 200 ml of water per hour. If you're doing light activity, you have to take 500 ml of water, of half liter of water per hour. Medium intensity, 1 liter. Heavy intensity, 1.5 liter per hour. In if you're not under sun, and if you're under sun, you have to take 0.5, 0.9, 1.3. So this is the tip. Okay, I hope you got the idea what amount of intake you have to take. Now, the thing is that this is the table for the normal thing. This is for before exercise and during exercise. Okay. Now we have to drink 17 to 20 ounce of water before 2 to 3 hours of exercise. 1 ounce is I think is equal to 30 ml. 1 ounce is equal to 30 ml. So it can be like 500 to 600 of ml water 2 to 3 hours before the activity. Okay, and you have to consume another 7 to 10 ounce of water after the warm up. If you are doing 10 to minutes of warm up, then you after warm up you should also take the 7 to 10 ounce of water. Now during exercise you should take 28 to 40 ounce every hour of exercise. Okay, and it should consist of electrolyte also, that is that I mean 0.5 to 0.8 percent of the electrolyte in that. Okay, then you have to rapidly replace the fluid. As I've already mentioned, the body weight mechanism you can take the pre and post body weight, and then replace it in your drink. Okay, the amount of body loss you got, then calculate that and take the hydration. Okay, then I just want to mention one fact. Excess body fat negatively impact the exercise performance especially in heat. Okay, because it retards the heat transfer to the periphery. Now, if the person is having excess body fat, fat act as an insulator. Okay, when there is increase in the core temperature, okay, what body normally does, it diverts the heat towards the periphery. But in the person of excess body fat, there is a layer of excess body fat in between the core and periphery. Okay, and fat is an insulator of the heat, so it won't allow the core heat to transport or to transfer to the peripheries, resulting zero decrease in the temperature of the core, resulting heat exhaustion. Okay, I think you got it. So that's why it is recommended to reduce the excess body fat in the person who are doing the sport like football, marathon runner, sprinters. Okay, so that less body fat, better heat transfer to the periphery. Okay, and less chances of getting the you can say complication like heat stroke or heat syndrome. Okay, heat cramps. Now, this is the thing, exercise in cold. So what is going to happen if you are exercising in cold? You got to know about the heat. Okay, what will happen to your body if you are exercising in cold? Like normally the temperature we take about like it is of 37 degrees Celsius. Okay, and if it is goes down by 2 to 3 degree, it comes under mild hypothermia. Okay, which leads to the shivering of the body, increased blood pressure, decreased blood circulation towards the periphery, the amnesia, slurring of speech, that is dysarthria, poor judgment. Okay, the ataxia, apathy. Okay, now if the temperature goes further down 3 to 4 degree, that is 31, 30, 39, 29, 32, that is comes under moderate hyperthermia. The person feels stupor, shivering halts. Once the shivering halts, no heat will be there, which means the previously some shivering was coming, this time it is also not coming. Okay, the pupils will dilate, the person can get the cardiac arrest or the cardiac arrhythmia. Okay, the person may get like the confusion. Okay, the cardiac output will decrease. Okay, unconsciousness can be there. Fine. If I talk about, if the further temperature will go down beyond 29, it comes under severe hypothermia. Okay, which means the person can get, this is a medical emergency. Okay, the survival chances are very, very much low. No coronary risk facts, hypotension, fibrillation, loss of reflection, acid balance disturbance. So these things gonna occur. Okay, so this is the response, physiological response of our body when you are exercising in cold. Okay, then that we have already seen this slide in the hot one. So I have again I am showing this just to remind you, when there is cold. Okay, again the body will react to decrease the heat loss by vasoconstriction and shivering. Okay, and also increases the thyroxine and epinephrine secretion, so that the metabolic and the metabolic heat or resting metabolism increases, so that the heat increases, so that the core temperature will increases. Okay, so that the thermal regulation will take place. Now, what type of clothing we should wear when we are exercising in cold environment? As you have already experienced or mentioned by your family members or your parents, like wear the woolens in the winters. Okay, wear the animal fur or feather products, synthetic fibers, because they trap the air. The woolens trap the cold air and warms it, so that it won't let the skin of your body get cooler. Okay, whenever the air enters in that woolen, it get warm, then it comes in contact with your skin. Okay, then the temperature maintains. Okay, when you are exercising, like you have wore the 2 to 3 layers of clothing, warmers, and you are exercising. So as the temperature increases during exercise, you are supposed to remove the layer of the clothing so that the temperature will maintain. Okay, because if you are wearing 2 to 3 layers of woolen and exercising, it doubles the temperature. It increases your temperature, resulting increase in the core temperature, and you get premature fatigue. Okay, now how the water and fluid loss is occurring during exercising in cold? We can understand, like in hot temperature the water and fluid loss is there, but how in the cool, how in the cold? Okay, how in the winters? So cold air, the cool air consists of less moisture. Okay, so whenever you inhales the cool air, it consists of less moisture. So what our body does, our body moisten that cold air. Okay, it moisten the cold air, it and it makes the cold air warm. Then it goes inside down to the trachea. So the process of moistening that cold air requires the water. Okay, so the more, the colder the air, more the unmoistened air, more the water utilization will takes place to moisten that. Okay, then when you expire in the winters, when you expire, the your expiratory breath can be visible. Tiny water droplets are there. The foggy expiration is there, which consists of water. Okay, so as you expire, the water loss is occurring. Okay, and in the cold temperature there is increase in the urination. Okay, during the cold temperature there is increase in the urination, which can also leads to fluid loss. Okay, so the fluid loss occurring in the winter due to increased urination, and second is due to our respiratory passages. Okay, one more thing I want to mention, like the process of inspiring the cold air. If your body is dehydrated, if the sufficient fluid or water is not available to moisten the inspired the cool air, you will get your the dryness of the throat is coming, the itching sensation, or you can say the voice can be changed, pain in the throat can occur because due to the less amount of water to moisten there, because the unmoistened cold air makes your throat dry and painful. Okay, so it is always suggested to wear a scarf, okay, or a mask while exercising in cool, so that whenever you expire, okay, or let's forget about expire, whenever you inspire, when the cool air traps in the woolen and comes into the mouth, it slightly gets warmer, and whatever the water moist and whatever the coldness of the air is there, it goes down, so that less fluid or water contribution in moistening or warming the air takes place. So the water loss will get down, your throat will not get dry and painful. Okay, so this is all from my side in the exercise in hot and exercising in cold. And one more thing I want to mention you guys, yes, you can also implicate these exercise in hot and cold in your clinical settings also, by keeping the track of the temperature of the person, by keeping the track of the hydration status of the person, and also by keeping the track of the proper body movement of the person. Okay, proper warm up as per the weather, it is cooler or winter. Okay, so what happen, when you are doing exercise in a right way as per the temperature, the more effective your exercise will be. Okay, if you are doing less warm up in winters, the activity of the muscle won't get that much good, and if you are doing much warm up in hot temperature, then the person will get premature fatigue. So you have to be like after analyzing. So after analyzing the temperature of the body, one more thing I want to mention: temperature, hydration status, and the humidity. Hygrometer is there which measures the humidity. So these three things you have to track, and then you can implement your exercises. Okay, so this is the last time I got. This is the all time I got to give you the brief idea about that, and I hope about this I'll get the more session with you guys to tell you about what is the protocols and regimes you can apply on the clinical settings or the sports person to implicate your best exercise response to the your patient, so that he can get better, he can get cured, he can get free from any injuries, and he can perform well either in the sports settings or non-sports setting. Thank you very much, and now to you, Dr. Neeraj sir.
Thank you very much, Jatin. It was a very informative session, and it has definitely opened our eyes a lot regarding the exercise physiology. At least in clinical environment, we hardly take care of such things. So that will definitely be helpful to the clinicians as well as the therapists who are working in the sports field also. Thank you so much for that. Um, Friends, if you are having any questions, you write down in the chat. Exercise physiology. At least in clinical environment, we hardly take care of such things. So that will definitely be helpful to the clinicians as well as the therapists who are working in the sports field also. Thank you so much for that. Um, Friends, if you are having any questions, you write down in the chat. Exercise physiology. At least in clinical environment, we hardly take care of such things. So that will definitely as well as the therapists who are working from your YouTube. Thank you so much for that. There is a rebound voice actually.
Sir, am I audible?
Yeah, it's fine. There was a second voice from, I think, yeah, now it's absolutely fine.
Okay.
Friends, you write Q in front of the question, and so we can perceive that this is your question. Sir, shall we start taking the questions?
Yeah, sure, sir.
Yeah, thank you. Sir, Abraham is asking how about exercise acclimatization for pregnant women in clinical setup?
Yes, it is a very nice question, I would say. Like for pregnant women, the many things can be there, sir. During the many in many setups, if I have seen, I mean not less in India, but outside India, if the pregnant woman wants to do a good cardio, the temperature, BP and pulse have to be keep in track throughout the process, and the acclimatization only takes place when the person perform the exercise in that specific temperature or specific weather. Then only the acclimatization would take place. But in the pregnant woman, I would say there is no need to stress the body that much, because if the acclimatization is getting takes place, as I have already mentioned, the core temperature transfers from core to periphery. But in pregnant women, there one person also which is getting the circulation. Okay, so I think it's not that much impactful, or I think useful if the pregnant woman wants to do acclimatization, but she can do at the minimal or moderate level.
So Vinci is asking that, what are the precautions for cancer patients?
What are the precautions for cancer
Can
patients? Sir, for cancer patients, the I would say the patient can only prefer to do the minimal exercises, and it also depend what stage of the person is having. Either it is on chemo or any surgical procedure had been made. So on basis of various things, various parameters, we can only say about this precautionous measures for acclimatization.
good. Um, Friends, we have posted the link in the comment section. So you can take the form link from there and you can fill the form of 3 entries.
So I think there is a very very nice question that a person has asked. What kind of clothing should be done by a hot-blooded mammals who are exercising in gym for to strengthen the body and with high body fat in both hot and cold climate conditions? So I would say many people in the gym prefer to wear the cotton t-shirts so that the sweating will get already I mean absorbed by the cotton, but this is I think I would say that this is not the right thing. You should not prefer the cotton clothing during the exercises because the cotton absorbs the sweat earlier. Okay, whereas the work of the sweat to comes on the skin and evaporate so that the cooling of the skin will occurs. But if you are wiping the sweat before it doing its work of evaporation, it will be of no use. The more the sweat loss will be there and decrease in the temperature will not take place.
Uh, Sir, this is a question. What experienced by diabetic individuals in hot and cold environment?
Okay, in the variations that an diabetic individual in hot and cold, like there are many guidelines depending upon the level of the persistent of diabetes in that person. Then only we would give the exercise protocol. But for now, they are suggested to do I think 120 to 150 minute of cardio exercises throughout the week, and during that they have to keep their hydration track. Okay, because in a diabetic person during exercise the urine output is also more. So during the exercise, if they are exercising for, I think it is not suggested to do exercise more than 45 to 50 minutes daily for a diabetic person. So I think not much variation can be experienced by the diabetic individual, but in hot temperature it is sometimes experienced because because the blood circulation alters, the glucose level alters. As per the premature fatigue can also be there. So in hot environment the person should do a slightly minimal exercises as per his the level of diabetic at the present. And I would say I would answer this question in a detail if I got to more chances to. Okay, because it is a single topic again, exercising for diabetic person in different temperature. So many indexes are there, like windmill index for the cooler environment, and for the hotter one, there is a wet bulb and global apparatus to measure these strategies that the person has asked.
Yeah, friends, we are going to organize. Sir, I think some sound going from your side. Yeah. So we are planning to organize a masterclass with Dr. Jatin Maheshwari, sir. So I think in the masterclass we can cover such kind of topics as well. These are quite interesting and can be a great help. So, so what do you say about that?
Definitely, sir, we can go through because it's a vast and very much important topic. Like the people having a very misconceptions for diabetic and osteoporotic person also, and also
Hmm.
for the thyroid patients also. So I mean, we can do the things very well.
Yes, sir. Uh, Sir, another question is related to diabetes only. What will be the precaution needed to take for diabetic individuals?
Okay, the precautions I would suggest to take the normal precautions for the diabetic person, like do not exert the body that much, do not exert the muscles that much, because like in an individual, if you're doing 1 day exercise, it would take another day to recover. But in the diabetic person, it will take a slightly more time to recover. That is why, as per the American College of Sports Medicine guidelines, only 150, I think 150 to 160 minutes of exercise per week it is recommended. Okay, and it is also recommended to exercise on the I think 60 to I think 50 to 60 percent of VO2 max. So which is indicative that they also not want to exert more stress on the person. To keep in track the pulse, keep in track the blood pressure. keep in track the heat, and keep hydrated. The person will be fine.
So Mohammed Hatim is a person with hyperhidrosis.
Like there are many misconceptions in the athlete or the sports person ki if we drink much water before any exercise, so it can remain impactful throughout the its workout or throughout its game, but it is not that much impactful if you drink more water in exercising in hot weather. If you're taking more water in your one time, that will not improving your performance. It will stimulate more of urination. It will make the person heavier, and the vomit response can also become the gastric emptying. If you have if you know, Mr. Muhammad Hatim, that the gastric emptying time of water is 0 to 1 minute. And if you are drinking much water at one time, it will go to the urination, and the person can't concentrate on uh, the game. Okay, so I would suggest the guidelines which I have given, like take the 17 to 20 ounce water 2 to 3 hours prior, and half an hour prior, or we can say after the warm up, take to 20 to 30 ounce of water, and keep that 0.5 to 8% of the electrolyte in that. So I think going with these guidelines can make the person perform better even in the hot weather. Any more questions, people?
There are many questions. What electrolyte we should add in water after exercise?
Okay, the main electrolyte which the person focus should be the sodium. But right now the Gatorade drinks and many electrolytes is coming with the all the sodium, potassium. Okay, so you can also add that. And I would say, I would, if you have asked about the electrolyte, if you want to go with the natural one, if you take a 1 glass of orange juice or tomato juice, it will recover all the electrolytes in your body.
Right. So Sudhir Rana is asking effect in skeletal system.
Yes, there is very much effect. It is a itself a individual topic. There is a, if I talk about the during heat in the skeletal system. Okay, in the skeletal system during heat, there are many differences like stroke volume. The cardiac output remains the same, but the stroke volume increases. And when the stroke volume increases, there are many much effect comes on the body. Okay, on the heart. And if I talk about the muscular system that the person have asked, the premature fatigue can take place. Okay, if the person is exercising in heat without any water intake, without tracking of the temperature, is it increasing high or no? So premature fatigue will take place. Acid base balance disturbs, which leads to the excess and earlier release of the lactic acid, which can causes the fatigue in the muscle earlier. Okay, which can lead to premature fatigue, which can leads to the you can say more soreness to the person.
Quite interesting. Yes, sir. Temperature we lost the then what will do for recover the fluids to the body?
Okay, as I've already mentioned, nothing to related about the fluid loss occurring in the heat or cold. The thing is, the dehydration is taking place. And please follow the hydration guidelines that I have mentioned, or if you're having a better research article for the hydration, you can follow that also. And I have simply mentioned the body weight loss which occurred pre and post your workout, just accomplish that.
Sir, Vipra, people have a mindset that when you do exercise in indoor setup, they switch off the fan and say more sweating leads to more fat loss. What's your opinion over it?
Look, sweating is does not have any relation with the fat loss. The fat loss relation is related to your duration of exercise, the intensity of exercise. That's all it matters. Doesn't matter, like if you are switching off your fan, I mean it would never make that much of sense, but the temperature is too much. And if you are switching off your fan, and if you are like, one more thing I want to mention, if you are switching off your fan, if you are closing your windows, okay, the more chances of humidity is there, more chance of suffocation is there, so you can't exercise in that area. I would say do not off your fan. It only depends upon the duration and intensity of exercise for the fat loss. Switching off the fan does not make any sense. It more increase your core temperature and make the premature fatigue.
So what do you think about
So can you please repeat?
what do you think about the hot yoga? Means there is a concept that they generate heat inside the room and then do yoga, so they get more perspiration. What do you think about that?
Sir, about that, I just gotten one idea. In cold environment, your BP is high. Okay. In hot environment, the vasodilation is there. The soothing of the mind can also be takes place in vasodilation. Okay. So I think that concept they are following for the hot yoga. And another one is the another concept that it is a yoga. They also follow the concept of detoxification of the body. So when the vasodilation takes place, the sweating comes more and more. The detoxification of the body comes. That's all I think they are following the concept.
So there is nothing wrong we are doing that.
Nothing wrong until or unless it is not causing any harm to the body. Everything should be done in a neutral way. It is okay.
And sir, what about the general environment in the clinics? Generally, nowadays, most of the clinics are having air conditioning system and maintaining temperature around 22 to 24. So, what is your idea? Means, what can be the ideal temperature for the patients in clinical environment?
Sir, I would say I think 24 temperature is okay. Beyond that, because we do not change the protocol which is applying on the person. If we are saying ki please perform 50 repetition of this exercise, the person will follow the 15. Sometimes we can change the protocol, but I don't think so ki many time we just look at the AC and set the temperature and then ask the person to follow the regime.
Hmm.
So this is the thing. 24 I think.
For the fitness patient, what is the precaution for exercise about hot and cold environment?
Okay, first of all, if the person is coming for fitness, I don't think so calling the person patient is a good thing. So if the person is coming for fitness, we should be following the tracking of humidity, tracking of temperature, tracking of pulse. Okay. And clothings, hydration. Okay. And intensity of exercise as per the requirement. If you are calculating a good VO2 max calculation, a good requirement of intensity, like at what percent of VO2 max you have to apply. If the person wants to do initial, and I think initial stage we prefer to do 60 to 80% of VO2 max of training. And initially, when as the level increase, we go to the 80% VO2 max, 90% VO2 max. Okay. So in that ways only we have to train any kind of a person if we talk about a fitness. Okay. Like if the person is a intermediate or beginner, if you are providing him 90 to, we can say 90 to 100% of VO2 max or maximal intensity of exercise, then the person may after some time the person after some time develop a condition like athletic heart syndrome, that is the eccentric hypertrophy of the heart. And in many cases, if you may heard, the person is doing the jogging since last 10 years, still the person get the cardiac arrest. Why?
Yes.
It is just because they are doing overtraining. They got the eccentric hypertrophy of the heart, which leads to the cardiac arrest.
Hmm. So is auscultation important for exercise physiology?
What kind of auscultation? Alfia Chani. What kind of auscultation?
Alifia, if you are listening, then please write again your question with detail in the chat group. Uh, Gucci is asking how much water we should drink with exercise and without exercise for common man every day.
Yeah. With exercising, I've already mentioned ki every hour you have to take water. That the few ounces I have mentioned with the electrolyte. And if you are at rest, and if you are at room temperature, I think the 0.2 to 0.3 liter of water per hour you should take. And if you are doing an intense exercise, you have to take the water of, I think, what we have mentioned, like the body weight concept you can apply, but you have to drink the water.
So Samir is asking for acclimatization. Please share reference as well as how we can improve our knowledge in this field.
Okay, Mr. Samir Said, physiotherapist. In few slides, I think I have mentioned the references. You can search about those referencing site, and I'm sure you're gonna get the things. And further, you want to improve your knowledge in this field, you can prefer the references best from the American College of Sports Medicine. So I think, and many books are there, but more preferably for the latest one, you should go with the ACSM.
Abravama is asking link. It is there in the description box, so please go through it. If you cannot find it, just refresh your YouTube channel. You will be able to find it. Yes, sir. Sudhir is asking if any person after surgery, what type of exercise they do.
Mr. Sudhir Rana, that I can tell you when I've been knowing the site of the surgery duration, and depending upon the what kind of scar the person is having.
Sunil is asking what is the physical signs of warming up and how much time it should be done.
Okay, the physical signs of warming up is ki your heartbeat should not be that much ki that your hand will shiver whenever your heartbeat. The fingers does not impact with your heartbeat, and the normal the minimal sweating can be there on your skin, and you should warm up for 15 to 20 minutes.
Uh, Pratap is asking that reason behind the high altitude training people have butterfly mark and face on face. I think so.
Mr. Pratap Sankar, I'll answer your this question in tomorrow, as I'll be taking the high altitude during the exercise.
Yes, sir. Elaborate about presentation also when you have raised the
Okay,
topic. Yeah.
okay, guys. Tomorrow I'll be taking the exercise at high altitude. What are the changes can be take place, and how it impact the cardiovascular system, muscular system, your pulmonary system, your psychological status. Okay, and many things are there. Many people have a misconception about to training at the high altitude mask at the flat ground surface that can't that either it is making any impact or not. And like say for example, if a sports physiotherapy perspective, if the person from India is going to play in the Netherlands, can a person perform at the same level there? Because there are different altitude, different atmospheric pressure. So how the person is going to perform? How many difficulties the person is going to face, and how we people, the common person, which we like we are going for tracking and all. What are the things we should be knowing, and what are the sports training precautions measure the sports athlete should take if he is training on a high altitude. And one more thing for a common person, like if you are going, few things I will clear a concept, like if you are going on a flight, why the flight is going in what way, why the belt is going to pour, and why the seats are slightly back down. So many concepts I am going to clear tomorrow in the next session.
Fantastic. Sir Rajat is asking, eating is good after 1 month replacement for reduced swelling of limb.
Is eating is good after 1 month of TKR for reduced swelling of limb? Okay, first of all, Mr. Rajat Kumar, you have to be sure that the swelling, what grade of swelling is this? It is movable or not, and I would not suggest to do the heat on the swelling. I would suggest to do the cold pack on that. I think it would give a good result.
Sir, one more question. In this COVID situation, people are wearing the mask actually, and people are more alert about their exercise and fitness also. So we can see many people wearing the mask and doing cycling and jogging and exercising. So what is your idea about that? They should wear the mask, or it can influence the oxygen level inside the body?
Sir, I would say one thing about that. Like if I am doing, like previously, I was doing the 60 to 80% of VO2 max exercise without mask. So this pandemic is there. We should not do the same amount of 60 to 80% of VO2 max exercise by wearing the mask. Either you should decrease your intensity, then do the exercise, or you can just uh, expose the nose. That would be the better one. Because right, many, I think 2 3 times I have heard about the person is doing the jogging by wearing the mask, and he got the cardiac arrest or the lung failure. So this is the thing, we should be taking things in our mind. And nowadays the, I think the local N95 masks are also there. People are just using that. I think the valves are not the original one that they have put it on those masks. So I would suggest not to do the same kind of intensity of exercises by wearing the mask that we're doing previously without the mask. Either they expose your nose.
And sir, related to the COVID, what do you think about going to the gym and doing the exercises in gym environment? Because many are having concern about the sweating. There are a lot of sweating and chances of contamination. So what is your idea about that, sir?
Sir, I think for now, if possible, they should do the exercise at their home. I think if they have waited for 3 months, 4 months, nothing wrong in waiting for 1 or 2 months more. I think because life is very precious, they can even improve their fitness after 2 months also. But unfortunately, once they get the COVID, their 50 to 60% of lungs can be damaged, so which cannot be recoverable at that peak.
Hmm. Fantastic, sir. Shani is asking what timing person who want to gain weight and person who want to lose weight.
Look, a warm-up timing variation in person to person does not impact that much, but your exercise duration does. Okay, it is suggested as per the research, if you are exercising more than 45 to 60 minutes, then it will comes to the energy cycle of your aerobic one. Then only you can going to lose the weight. Okay, so it doesn't matter about the warm up, but yes, the temperature matters about your warm up. The temperature is high, you should be doing less warm up. If the sweating has induced, just stop the warm up. And preferably, please, I request all the person who is asking about the warm up of the body. Yes, do the proper warm up, but right now people are doing the functional warm up. Okay, like if you are doing today, you are doing to do the shoulder exercises, and if you are doing more of cardio in your warm up, what is the use of that warm up if you are not warming up your shoulder muscles? So please include the functional warm up strategies also.
Can plyometric apply with cryotherapy?
Can plyometrics apply with cryotherapy? Okay, in what sense they are asking about the plyometrics with cryotherapy? Because that much I have heard about the cryotherapy people are using for the weight loss, but for the plyometrics, I don't have any idea about that.
How much percentage of humidity after workout in both hot and cold climate condition?
Okay, if I say ki, what amount of electrolyte, like if you are replenishing your fluid loss during exercise either in hot and cold, it is recommended for 0.5 to 8 gram, I think per 100 ml. That is recommendable. You have to involve in your drink. And if you want to make it on your own, you can put it 0.5 to 0.8. But meanwhile, many drinks in the market have been coming with the electrolyte, and you can induce that during electrolyte drink that is coming in the market. You can take during the event. But if you want to replenish the fluid after and before the exercise, you can implement the process of 0.5 to 8.
Niga is asking a normal person can the body heat after the exercise. Will sir, you can read the question.
Uh, okay. Look, to reduce the heat, the body is doing the work. To reduce the heat, the environment is also a big factor. Okay, like if you have the space to, if you have a cooler space to exercise, if the environment is hot, then you can prefer to do the exercise in a neutral temperature or with a slightly cooler temperature. Okay, but if the person is concerned, you can keep your hydration updated. Okay, if the person wants to do something to reduce the height, just keep the intensity as per the temperature, keep the duration as per the temperature, and keep the hydration status neutral. And how you are going to keep the track of the temperature and humidity, there are various. If you can, there is a hygrometer for humidity, thermometer for temperature. So by that you can do that. And how is it compatible for your body or not? It is a vast thing. I can explain it later. It is a apparatus like wet bulb and global apparatus is there, which measures your body compatibility, like how much heat is comfortable for that person. But for now you can just keep and track the hydration. Dr. Rajeshwari Murugesh, nice question. But what is the cause behind the restriction of the water intake for that person? Then only I can suggest the exercise protocol. Yes, it is possible that a person may get the rashes with the polyester clothing, but there are different variety of polyester also that is also come with the sensitive skin. There can be the less thickened layer of that polyester. You can get it from the any market. I think they have the for the sensitive skin also. And sometimes people may apply the talcum powder to avoid the rashes by using the polyester clothing. What kind of food be taken after workouts, sir? Okay, I think you can take the carbs and protein depending upon the what kind of training you want to pursue, either for the fat loss or the endurance training or the power training. As per that, you can take that to be mentioned in the chapter that is nutrition in exercise physiology. Heart patient, diabetic patient, and asthmatic patient, what type of exercise? Again, look, different condition related to the individualization. As you have, if you have gone through with the principle of exercise training, individuality is a thing that comes. There is This is the question related to the exercise prescription of the person. Okay, I will tell you later in detail, but for just for a brief idea, I will tell you for heart patient what kind of disease the person is having. Okay, for diabetic patient, just track the diabetic. I have already mentioned the guidelines, that is 150, I think 140 to 150 minutes per week you can do on the 16, just in between the 50 to 80% of VO2 max. Okay, and for the asthmatic patient, it is also the heart patient and asthmatic patient is to be assessed, then the exercise can be given. Ask the person to take rest with the proper medication that is to be going on. Same, Sudhir Rana, the guidelines you can go through with the ACSM guidelines of diabetic. Many books are there, like if you can go with the ACSM books, Catch and Catch is there for the brief one. For the guidelines, you can go through with the ACSM. Are different exercises prescribed as per temperature to get the required? Yes. You need to understand the thyroid physiology. That will I will take in the module.
Sir, I don't think this is relevant to the. Uh,
That is the questions related to the exercise physiology impact on the nervous system. That can be taken in the module, but you need to understand the phenomena or the physiology of the multiple sclerosis. Next. Whenever go to AC and cooler room suffering for cold, sometime it is start my childhood. Sir, you are requiring to boost your immunity. I would suggest to do the moderate aerobic exercises, because moderate aerobic exercises will improve the function of your endocrine system, and that will lead to this situation that you have mentioned. Specific symptoms can be asked during high intensity workout about temperature or discomfort. Yes, first of all, before going to the high intensity workout, you have to mention all the VO2 max measures of that person. You have to keep in track during high intensity exercise. Always keep in mind to track the BP and the pulse of the person by keeping the tracker on the body. Then only do the high intensity exercises, and meanwhile just ask the person if there any chest discomfort, any breathlessness is there. Okay, or any a sort of you can say unconsciousness type of feeling the person will have, because high intensity during many high intensity workout the person doing that in a hot environment, because the person who is doing a high intensity exercise, it has a kind of a mind that I have to do that, I have to do that, and nothing can stop me. In those cases, keep in track the symptoms like any breathlessness, chest pain, or any kind of headache is going to happen, because heat cramp or heat syncope, heat stroke can take place. We have to be precautious for that. This is called delayed onset muscle soreness, Mr. Lalit Mehta. This is due to the high accumulation of lactic acid. So proper warm up, proper cool down, and proper exercise protocol to be followed toward that. But minimal soreness can be there when you're starting new exercise initially. Look, about this question, I want to mention one thing. High intensity interval training consists of many high compound movement, and I have seen in most of the gym the heavyweight people are doing the high intensity interval training and damaging their knees and ankles. So before going to that, strengthen your knee, strengthen your lower back, strengthen your core, then proceed further. Meanwhile, you can do that for the if you're having a laxity on the knee joint, ankle joint, just strengthen that first, then go with the high intensity interval training. And I would say to prefer cardio exercises. Many tests are there, ki stepper test, 12-minute walk test. Okay, you can do that. The calculated formula is there. You can put this in. Just measure the distance, measure the heart rate, put that in the formula, age, male or female, you can get the VO2 max value. I would say to prefer 12-minute walk test. Is there any thermal changes occur when there is DOMS after exercise? Not that much of thermal changes occurs, but the acid base balance disturbance take place if you are exercising in more heat, then the soreness can be more. Normal water. You should take the normal water with the electrolyte. Do not take the plain water. Keep yourself hydrated. And if you feel any discomfort, stop the exercise.
I think this you have already.
This has been done. I don't think so. The auscultation is that much important during exercise, but keeping track of the blood pressure and pulse is most important for that. I think Justin, you have asked about the cool down exercises.
Yeah.
Don't drink it immediately, but you can take the normal water, and after some time you can drink the cold water. Dr. Rajeshwari, please mention the cause of the restricted. I mean, if the person is advised about the water restriction, what is the cause behind that? Yes, Dr. Sandeep, I have mentioned a table of the water intake as per the temperature, as per the rest, moderate and minimal intensity of exercise. So you can go through with that. You will get your answer there. How can we raise the core and shell temperature during warm up for the upcoming match in the winter season in the coolest area? We have faced a lot of problem in the particular season. Okay, Mr. Rudra, I just want to mention one thing. If you want to adapt your body in any kind of temperature, you have to do the training in the same temperature. Suppose, okay, I mean, this is a question, this is the thing I want to mention in the module, but I would say just give you a brief idea. Like if you're going to do your match, I don't know about your sport, but if you're going to perform in a 18 degrees Celsius of temperature in that country, practice in your country at 18 degree of room temperature with tracking of blood pressure, tracking of pulse. tracking of temperature, tracking of humidity, and keep your hydration status on. And in an increasing order group with a view to max 60, 80, 80, 90, 90, 100. In that way, you can achieve that. Okay, and do not exert more. Do not exert forcefully your body. It takes time. The acclimatization takes time. You have to be patient. Okay, to keep yourself warm in a cold weather, first of all, the clothing. Okay, just slightly increase the warm up period. Okay, and keep the. I think you can drink the warm water also. Warm, not the hot water. Warm. Exercise for physiotherapist having osteopenia. I'll be taking this also in the module, but preferably I will say for the osteopenia, mainly we do the minimal intensity exercises and mainly the weight bearing exercises because weight bearing exercises induces the correction of the osteopenia. And there are different strategies to do the closed chain exercise, weight bearing exercise, and very precautious it is. So I can explain it in the detail later in the module. An athlete comes to you, they have been suddenly called up for an outdoor competition in India. Temperature can reach over 40 degrees. They want advice on what they are drinking strategy. Like the drinking strategy that I have mentioned in the presentation, they should take 2 to 3 hours prior. I think 70 to 20 ounce of water. Then after warm up, then in between the matches and after the matches. So I think that would help.
Yes, sir. This is
Sorry.
yeah, Dr. Rajesh. We asked you a question regarding the restriction of the water. And this is the same one actually. She
Okay.
said what
Advise and I think the minimal intensity of exercise I would suggest. I would not say ki please exert the person. Normal exercise is normal. I don't think so that without taking full assessment of the person, I would suggest you do the exercise. And if the person is already in the dialysis, no need to do the high intensity exercise. There are various articles saying high intensity exercises are helpful in PCOS. What is your opinion on that? Yes, I have already explained. If you are doing a good aerobic exercise, okay, the hormonal changes that have settled in your body that is causing the PCOS is going to correct it. The hypothalamus is going to, if you have heard about the athletic triad, female athletic triad, in which there is less working of the hypothalamus due to the less hormonal activities there. So the high intensity exercises or cardio exercises reduces the stress of our body. As for the hypothalamus also in the hormonal imbalance be corrected. That's why the PCOS have a positive response in that. Can you explain ATP creatine phosphate levels Z line? Yeah, this is the basic thing I'll be taking in the module in the exercise physiology of musculoskeletal system. Summer season in South India, some of the tournaments are going to in the temperature of mostly this. How can we manage the body temperature and long duration of mates? Okay, look, if we talk about the South India, not the temperature is uh, invading, but the humidity also matters. The humidity is also there. So you need to keep in track about your hydration status, your clothing style, light color, okay, your clothing style, and your hydration status. So by this and the temperature, the guidelines about the temperature, that the things to be worked or not, like the game to be played in this temperature or humid or not, you can get it from ACSM. I let you know in detail about it in the module. Thus, electrolyte lost during workout effect on calcium absorption in food and B12 synthesis. Okay, first of all, if the electrolyte have been lost in your workout, you can take it through the fluid. Okay, do not think about the food. Like I'll be going to eat, then the electrolyte will replenish. But after the exercise, take the electrolyte in the fluid form. It would be a better thing, and it also consists of some glycemic index thing that you will be knowing in the detail. Ki there are various glycemic index of the food, three glycemic index, and which glycemic index to be taken in which phase of game, you will be knowing that later.
So it's almost 4 minutes left. We will take two
Okay.
more questions.
Yeah, sure, sir, no problem.
Yeah. Yes, sir.
Okay. Like I want you have a slightly confusion in that. Look, the fat is the barrier to transfer the heat from core to periphery. Got it? This is the case when temperature is increasing. Clear? Now, the mechanism behind reducing weight is the exercising beyond 50 minutes. Got it? Just because sweating comes first after exercise. Now, if you are exercising, more sweating the more sweating will come when more hot atmosphere or more hot temperature is there. So, what you should do exercise in neutral temperature beyond 40 minutes, your weight is going to lose. Okay, so there are two concepts, do not mix that. When the heat is going to increase abnormally, then the fat percentage concept comes. But when you want to reduce the weight, this is the exercising more than 45 to 50 minutes. Then the aerobic system comes into play and utilizes the fat to produce the energy, resulting the decrease in the fat in your body. Okay, I have already mentioned the please do the cardio exercises, aerobic exercises. Okay, this is the beneficial in this. So there are many things that can track the dehydration in your body, that I will tell you detail if the scientific method is concerned. But for now, you can keep in track by the urine color. There are four or five urine color is concerned that will tell you your body is hydrated. Now, minimally hydrated, sorry, minimal dehydrated, moderate dehydrated, severe dehydrated. Okay, the light pale yellow is normal. The dark brown or red is severe dehydration. So you will get the chart if you'll search. Or I will tell you later about that chart. And the few scientific methods are also there that will tell you the dehydration status of the body. That Dr. Neeraj sir will tell.
Sir, are you going to take massage?
Uh, sir, sorry sir, I missed that. Please, can you please repeat?
I think she wants. Are we going to organize a model on this channel? So,
So definitely, I would like to take the things this channel, and rest is up to you.
Yeah, of course, you are always. It is quite helpful. Your clarity of knowledge and the way you are explaining, that is phenomenal, sir. That is fantastic. So, last question. Yeah.
Intermittent fasting time when we exercise, can we take electrolyte water? I mean, what kind of intermittent fasting you are asking? During exercise? When we exercise, okay. Yes, you can take electrolyte water meanwhile when you are doing the exercise. And yeah, it's okay. Nothing to worry about that. But please take it in a specific quantity. Do not hyperhydrate your body.
Fantastic, sir. So much. And we really respect that. And thank you, viewers, for coming to this big number. And throughout the session, you were interacting. It was quite nice, and the questions you asked are very interesting. Thank you so much for that. This kind of participation, and we are looking forward to see you all tomorrow. Also, you and your friends as well. Tomorrow session is going to be much more interesting. Also, so please do come again tomorrow on the same platform. Sir, thank you very much. We are very happy to see you on this platform, and it was very informative for all of us. Thank you. Yes, Dr. Janvi.
Hi, Dr. Jatin. It was really amazing session. I must mention our deep sense of appreciation for Dr. Jatin Maheshwari for his explanation of applied exercise physiology during hot and cold environment. He has shared and covered all the aspects very perfectly. It was useful and informative session. Thank you, Dr. Jatin, again. Thank you, Dr. Neeraj, to organize all the technical session flawless and to select the faculty for this FDP is really a tough task, and Dr. Neeraj has come up with excellent faculty. So thank you very much, Dr. Neeraj again. Now, Dr. Jatin will be with us tomorrow as well. So, dear participants, we will meet again tomorrow sharp at 7 p.m. And we look forward to your active participation like today. It was really tremendous, session, and I can applaud. I would like to applaud to Dr. Jatin Maheshwari for excellent answer.
Thank you
That
so
means
much.
I was really surprised that you have given very thorough, logical answer to each and every query. So it's really commendable, sir.
Thank
Thank
you
you
so
very much to be part of this FTP. Thank you very much.
Thank you so much, and thank you, Oro University, for giving us opportunity to organize something good with you. Thank you so much for that, and thank you, Jatin, sir, once again. It's a wonderful time. Thank you, viewers.
Thank you so much.
Thank you.
Good night.